This is Shannon Holton, Real Salty Dietitian and owner of Sound Growth Nutrition and Wellness. This past Monday was World Obesity Awareness Week, and so today for our fun Friday research, I wanted to look a little bit at the policy, the science, and the actions around fighting the epidemic of obesity. And it is now declared a worldwide epidemic. There's an article I read the other day that shows in the areas where the Mediterranean diet originated, for example, there is actually a reduction in using that Mediterranean diet lifestyle. Things have become a lot more global as the world has better access and transportation and shipping and things like that. So it really has become more of a worldwide epidemic. So the thing that I wanted to really talk about or impress upon is looking at, the science and the policy that we have here in the United States and the actions that are going on as it relates to obesity. I can tell you it's not enough. And, some of you may already understand and know that. But we do know from a science perspective what causes obesity. We know that it's an increased energy intake, which is our calorie intake. And it's a decrease in physical activity, which we've seen progressively decline, especially even when we think about our young children in schools and the proportion of physical activity time versus academic time. So those are the two root causes of that. And what impacts those causes? What can make a difference in the amount of physical activity we get? What can make a difference in our foods that we eat and choose? And that is largely policy. Personal choices are definitely always a component of that. However, if you're in an economic disparate area where you have lots of low income or you have less access to whole grocery stores and you're mostly shopping convenience, you don't have the benefit of making those choices. You have to work with what you've got. From a policy standpoint, that's where the difference can be made. For example, when I speak of policy, there's two areas. There's the healthcare policy side of things, and then there's also the food supply policy side of things. From the healthcare policy side of things, one of the things that we look for and we're really trying to promote is prevention. So we know if we can prevent it from ever happening, our overall healthcare dollars will go down. So people will have less cost associated with their lifespan if they are not obese. And also access to specialists that can help with obesity. Having access to nutrition services is huge. There has been growth and improvement in access to dietitians from a healthcare standpoint. However, there's still a lot of barriers and there's still a lot of limitations on what can be covered. Oftentimes, policies cover dietitians only if you have diabetes or if you have kidney disease or if you have other medical conditions. If we're talking about prevention, we want to get to the patients and the clients before they actually are in that category of having those medical complications. And insurances still are not consistently always covering that prevention. Individual policies may, and so you really have to check with yours. When you get a blanket statement that says that my insurance covers nutrition service, it really usually is very specific, and so it's important to look at that to see whether or not that's accessible to you. Otherwise, it then becomes an out-of-pocket issue. There is science that shows that the cost of being on chronic medication for obesity-related disease is higher in the long run than it is with seeing a dietitian. It's about 3 to 6 visits with a dietitian, according to research, that impacts change. So it's, 3 to 6 visits with a dietitian and maybe some over the years supplemental visits to continue to maintain. But that's still a lot cheaper than being on a chronic medication for the rest of your life. Other policy related to our food supply, there is a lot of processed foods in our food system, and largely those resulted over the last 50 years with decreased cost of ingredients. So we find cheaper ingredients. And at the time when those are created, nobody knew that what the impact of those would be. We actually know now, though, that a lot of these ingredients can impact our overall health and wellness and our metabolism. In other countries, since we are talking about the world awareness of obesity, in other countries, they have taken policy measures to reduce the accessibility to those types of processed ingredients in their food supply, meaning that no matter what brand you buy, it's going to have the lesser bad ingredient. In the United States, we have not made those changes in policy, and therefore those options exist. Our food supply is broad here in the United States. If you have access to a grocery store, you have access to products like that, but oftentimes you can find that they're more expensive. And that's one of the things that, again, a dietitian can help with. And one of the things that I do with all of my families is talk about how to economically purchase healthier food options and how to do that in the grocery store when you have that grocery budget dollar. The other part of that policy is finding a way to make that policy happen that is data driven. And we have a lot of data about the numbers of obesity, but we're still working as a science community on collecting information on that cost benefit to be able to really say without a doubt that the cost of preventative health care is worth the eventual cost of having to pay for a disease condition. There are some smaller statewide initiatives across the country that are paying lump sum dollars to look at those different aspects of healthcare that aren't traditional transactional doctor visit. Some of them are looking at if we give dollars to help with some of the issues of food insecurity, meaning getting access to healthy, nutritious foods, and transportation so that you can get to a grocery store if you live somewhere where it's not walkable and you don't have a car. Those things are happening in small scale in lots of different states and communities, and it's the time it takes to put that together to be able to develop a long-term plan to have a broader United States policy as it relates to prevention. I do encourage people to look at what your state is doing and what your state has to offer. And if they don't, this is the time where we take action and we inquire and we push and are persistent. Most states have dietetic organizations that help to work on public policy. And so they're there in the background, behind the scenes, advocating for some of those access to nutritional care. There is a lot more that can be said on the topic, but as far as bullet points, that's what I wanted to share, and hope that everyone has a wonderful weekend and look forward to talking to you next week.